All right, now still on the doctors' strike, one of the contentious issues that the doctors' union wants to resolve is medical interns' pay and postings.
Well, the doctors' union demands for 206,000 shillings pay as agreed in the 2017 CBA. The government is telling the doctors to take 70,000 shillings or leave. Now, to understand where the truth lies, our reporter Gatete Njoroge met up with a doctor who completed her internship in January to establish how much she was being paid.
For over a month now, doctors have been out of hospitals. Their voices only heard along the streets as they demand for the implementation of the 2017 collective bargaining agreement. At the heart of the contention is the demand to post medical interns and pay them the agreed amount, a gross salary of 206,000 shillings. But it is a demand that the government insists it cannot fulfill due to financial constraints.
There is no money that we can pay 206 per intern. Let them earn 70,000. And we are urging them that let them take up this 70,000.
Surprisingly, the 200,000 shillings is the amount that intern doctors who joined between January 2023 and January 2024 were receiving as monthly payment. We met with one of the former interns who spoke on condition of anonymity. She shared with us her October 2023 payslip, which shows a gross salary of 200,000 shillings and after deductions, the take-home of 139,000 shillings.
Different stations also they differ monthly, but the range is usually from 137 to 150. Yeah, because other stations they have hardship allowances. So gross total is usually around 217, others 206.
The pay was not absolute as they had to work for 5 months without a shilling before protesting, and that is when the money was released.
Tulikuwa tunakula vyakula vya patient na si uongo, hivyo ndio watu walikuwa na survive. Yeah. So we decided around April, May to go for another strike. It was around 1 month strike, and that is the time the government promised to pay us our money.
She argues that the pay is small compared to the roles assigned to an intern doctor who attends to over 200 patients at level 5 hospitals.
According to Kenya Medical Practitioner and Dentist Council, interns have 14 duties to do. They're the ones to clerk the patient, they're the ones to examine the patient, they're the ones to take the samples from patients, taking them to the lab, waiting for the investigation, starting the management plan, to also talk to the consultant.
So actually in level 5 hospitals in the counties, interns are they're primary doctors.
Having stayed home for over 1 year before getting an internship and the struggle of getting a job as a doctor in the country, she tells us she has resorted to do other side hustles to raise enough money to fund her studies abroad, where she hopes to practice as a doctor.
Mimi sahi najishughulisha na mambo ya urembo, like makeup artist. Udaktari try to drop my license here and there. Bado nangoja feedback kwa sababu kupata kazi siku hizi lazima uwe na influential, mtu ambaye anajulikana kwa serikali ndo akupushie upate hiyo kazi.
2010, intern doctors were earning 80,000. Then when the new government came into power in 2011, the money was added to 140,000 after negotiation without CBA. And then the CBA came in and it was pushed to 206. So when any government or any government tried to reduce it back to less than what it was over 15 years ago, that is a total exploitation.
The doctors who pay tuition fees of about 3.5 million shillings to 4 million for 7 years are hopeful that the government will agree to implement their demands and end the suffering of Kenyans who need their services.